Hello, my name is Julie. I currently work at the Birth Center here at Catholic Regional Medical Center. I work primarily as a postpartum nurse, but a big part of my duty is to stabilize infants at the time of delivery. During my short time that I've worked at the Catholic Regional Medical Center Birth Center, I have noticed a few physicians like to practice in delayed cord clamping, whereas others do immediate cord clamping. And this triggered my interest. I wanted to look into research myself, and I wanted to see what the actual benefits are of delayed cord clamping versus early cord clamping. I've noticed that a lot of the physicians that practice delayed cord clamping are really strong advocates of it. They truly believe that this is the best outcome for infant and mother. As a stabilization nurse, I often am the one timing down that full minute and communicating with the physician when it's appropriate to clamp the cord. Because of this experience in the birth center that I've had with the stabilization process, I decided to do some research of my own. I conducted research for a class that I'm taking at Columbia Basin College, and I really wanted to formulate a good question to guide my research. The question I came up with was, in maternal newborn deliveries, would delayed cord clamping of 1 to 3 minutes versus immediate cord clamping of less than 1 minute prevent postpartum hemorrhage and improve iron levels in infants by 6 months? Taking this research question, I began to review different databases that are provided through the Columbia Basin College website. The typical one I use is ProQuest. Through this research, I was able to find 3 articles that fit my question on delayed cord clamping of 1 minute versus immediate cord clamping if they prove a benefit to decrease postpartum hemorrhage as well as iron levels in infants. My research did kind of take a different turn from the iron levels in postpartum hemorrhage. I actually found a lot more solely on the infant and hemodynamic stability. The 3 articles I found included timing of umbilical cord clamping among infants born at 22 through 27 weeks gestation, delayed umbilical cord clamping, is it necessary to wait, and duration of cord clamping and neonatal outcomes in very preterm infants. The initial article I found, timing of umbilical cord clamping among infants born at 22 to 27 weeks gestation, found a few things that have really helped the benefit the infant. Delayed cord clamping of 30 to 40 seconds versus immediate cord clamping of 5 to 10 seconds. This study found that delayed cord clamping improved temperature thermoregulation in infants at the time of delivery. Infants that had delayed cord clamping had a 97.4 average temperature, and infants that had immediate cord clamping had a 96.2 degrees Fahrenheit average temperature, which shows that thermoregulation may be impacted by the delayed cord clamping. This study also found that delayed cord clamping improved blood pressures. Infants that had immediate cord clamping tended to have lower blood pressures, and infants that had delayed cord clamping tend to have normal, stable blood pressures. Decreased red blood cell transfusions were also noted. Infants that had delayed cord clamping there was about 2.8 infants that would have a blood transfusion versus 4.1 in infants that had immediate cord clamping. The conclusion of this study found that at 24 weeks gestation, delayed cord clamping is safe and feasible, and it offers hematological and circulatory advantages. The main concern that I've found throughout my research is whether or not infant resuscitation can still be done with delayed cord clamping. And according to this article, it's very feasible, and it seems to have no impact on the safety of the infant as far as natal resuscitation goes. The next article I had was called Delayed Umbilical Cord Clamping, Is It Necessary to Wait? The benefits that this article found of delayed cord clamping goes beyond the neonatal period. The hematological changes actually affect the infant through life. The main benefit of delayed cord clamping, according to this article, is the increase in hematocrit and hemoglobin levels as well as iron. The article found that hematocrit and hemoglobin levels increased by 2 to 3 grams per deciliter. This article also mentioned a reduced number in blood transfusions, similar to the article I found before. And iron levels increased by 50 milligrams per deciliter. Due to this hemodynamic stability, the infant had improved neural function and cognitive development due to the higher hemoglobin levels and iron levels, the more stability of the infant. The risks that this article considered is the neonatal resuscitation, as I talked about previously, jaundice due to the increased levels of blood in the infant and the infant not being able to process that higher volume of red blood cells, and polycythemia. But all of these risks actually were found to be no significant risk. The infant actually had way more improved stability with the delayed cord clamping and no higher risk of jaundice than an infant that had immediate cord clamping. The next article I found was duration of cord clamping and neonatal outcomes in very preterm infants. This article did 2 different types of delayed cord clamping. One included 30 to 45 seconds and the other 60 to 75 seconds. They compared the 30 to 45 seconds versus the 60 to 75. This study found that in the infants that had 60 to 75 second wait of delayed cord clamping, they showed significant higher hematocrit levels at less than 2 hours of age, 49.2% versus 47.4%. The 60 to 75 second decreased intubation from 11% versus 22%, and reduced hypothermia, 1% versus 5%. The study also found that there is a reduced need for surfactant therapy, 13 versus 28%, as well as decreased need to intubate the infants. This study also brought in the fact that delayed cord clamping reduces the red blood cell transfusion risk. There was a 20% versus 33% difference in the delayed cord clamping. I believe that delayed cord clamping will benefit the infants at our facility. I believe that this is a safe change that we can make. According to my research, I haven't found anything that is harmful to the infant with the practice of delayed cord clamping. The only things I found are very beneficial. Having a few doctors already on board with delayed cord clamping, I see it as something that's pretty feasible to bring into practice. Especially with the infant stability afterwards, hemodynamic stability, respiratory stability, and improved blood levels and decreased anemia in infants. My plan is to bring this practice into the facility, make a change with specific guidelines for physicians to practice, delayed cord clamping of 1 minute, monitor hemoglobin and hematocrit levels at the 24-hour labs and see if the hematocrit and hemoglobin levels have improved on all infants, record this data and evaluate for a full year. I also think that this should be done on all births, including C-sections, if possible. Unless resuscitation is needed in that event, it would be safest to just go ahead and clamp the cord immediately to begin resuscitation. I believe we should also keep track, work in conjunction with the neonatal intensive care unit, keep track of red blood cell transfusions on infants that had delayed cord clamping, thermal regulation, blood pressure trends, respiratory interventions needed after birth, whether the infant was intubated, if the infant received surfactant therapy. I believe keeping track of this, making this a practice for at least a full year and evaluating the change should help bring this delayed cord clamping into practice and make it a new policy for our facility. The most important thing to reevaluate after a year of practicing delayed cord clamping would be to evaluate labs in infants, especially hematocrit and hemoglobin. Evaluate resuscitation, as stated. That includes surfactant therapy and intubation, and hemodynamics, including blood pressure trends and circulation for infants. I hope you take this information and conduct some research of your own and decide that delaying the cord clamp or delayed cord clamping of at least 1 minute will benefit our facility and improve infant outcomes and improve the safety of our infants. Thank you.